All right. I hope this recording finds all of you healthy and getting back on track, and as well as seeing through a lot of the bullshit that's going on mainstream. I received an email a little while ago from a good friend, very intelligent friend, who is concerned about everybody's safety and well-being when running around the woods this spring. And it goes along the same theme as just a handful of days ago, Dave Plides and I were texting back and forth about ticks and the best tick repellent. And I'm pretty sure I haven't had a chance to get caught up, but Dave made a video on his channel, Canada Missing Project, about the ticks they're running into and what they can do to prevent them, I believe. And coincidentally, this friend of mine sent me this email that asked me to share with all of you. Okay, here we go. Hi, Steve. Hope all's on track for you too. I know you're busy and no need to reply. I have a request, and I'm not all offended if it does not gel with your plans, but why not ask anyhow? I'm wondering if you'd consider a public service announcement type of video for the hunters and all outdoors people in general regarding infectious disease that lurks in the woods in North America. If and when the time is right for you. If the words are right for your audience, let her rip. Feel free to use them as you feel fit, and the linked peer review paper from the National Institutes of Health. Here's my experience and thoughts. I was taken out by a horrid mystery ailment June 2009. It took 6 years to find the culprit. It was rare. It was anaplasmosis from a tiny tick I never knew that bit me. 5% outright die in the initial stages. It is so systematically overwhelming, painful, and debilitating. I've been a hollow shell, a fraction of my previous physically capable self ever since. By then, it was far too late for treatment. The enduring and dramatic damage was done. To heck with cryptids or even predator attacks, those in the outdoors are far more likely to be laid low by one of these rather rare, life-threatening, and life-altering infectious diseases, and have few options for answers, or how to seek effective help for themselves. Though not included in this study, Lyme disease is by far the most prevalent outdoor disease/affliction. Many people and some doctors are aware of it and have a clue, but most do not, or woefully inadequate information and training. Only a third of Lyme infections produce the hallmark bullseye rash, and symptoms are proven to strike within hours, despite what many doctors presume. Very few professionals or laypersons know of the truly safe tick removal protocols. Instead, most engage in methods that force the tick to regurgitate its stomach contents into the bloodstream or leave mouth parts still embedded. Imagine the significantly rarer and equally devastating infections discussed in this published study. The medical bumbling and woeful inexperience that is deployed by the frontline clinicians, who can typically only relate to snotty-nosed children, decrepit seniors, in their limited, non-specialist existence. The number one cause of death in North America is medical error, and there are endless people out there with harrowing tales of bad or inexperienced doctoring. Often, it is only individual patient awareness that brings an oddball possibility forward. So a diagnostician can consider it, or that required patient awareness empowers the afflicted to push forward for results from secondary opinions, preferably from an immediate consult with an infectious disease specialist and immediate testing for all tick-borne co-infections. The diseases listed in the link attached are far more obscure than Lyme disease, and some also come from ticks. Unaware doctors typically leave such infected patients running a maze for precious weeks or months, or suggest it's psychosomatic because the symptoms are beyond their experience and training. Timely diagnosis and intervention is the difference between a short illness or a life destroyed. For most of these infections, immediate prophylactic antibiotics is what is called for, without waiting for the lengthy time for test results to arrive. Any specialist suspicion or one of these infections is more than enough reason to begin the benign therapy of antibiotics. That early intervention saves lives, livelihoods, and delivers outcomes that give the best hope for the future quality of life. If you think you've been infected by one of these, insist on full testing and the appropriate antibiotic therapy while the multi-week, time-consuming tests are done. Your physique, your work, your passions, your love, it all gets shredded with these kinds of mysterious, undiagnosed infections. Be your own best advocate. Family practitioners cannot know everything, especially the rare or obscure. They are not specialists, not the TV character House, but that is what you need with such infections. Stat. The advice to all who work, adventure, and play in the outdoors is to download, save, and read the article as best you can. Learn from various early symptoms. Retain that awareness and hope that you'll never need it. Forewarned is forearmed. Chance favors the prepared mind. All right, and I will put the link to this in the video description below, and hopefully in the podcast I can put this link, click-through link in there as well. And if you can't find it in the podcast, then go to the YouTube channel where I am going to post this email as a video. All right, so take heed, be warned, and be safe.